I think working as a hip is one of the best jobs I've ever had, so I would be very encouraging of anybody looking to come into working as a hip. It's one of the most helpful roles I've ever worked in. So seeing a lot of people for a short amount of time is really rewarding. Supporting the GP clinic team is also really rewarding. Hearing feedback in terms of how having a hip in their practice improves their quality of life, their working life, their work-life balance, and their job satisfaction basically is really rewarding. And it's an awesome way to work with people on the day as and when needed, and you know, a nice simple kind of plan around whatever problem's on top for the day, and people find it really, really helpful, so it's a great job. So what makes a great hip is somebody who's got flexibility in the way that they operate, not only themselves as a human, but as a professional and a clinician. So being a hip really requires a lot of kind of dynamic way of working, I guess. So juggling a lot of different things. We're seeing patients, we're supporting the GP clinic. Having initiatives is a really great thing. Often we're starting new pathways of care or running groups, and we're sort of really picking up on what's needed in that clinic at the time. So being dynamic and adaptable and flexible is great. Obviously some really sound intervention skills is important. So often people who have had experience in using talking therapies such as CBT, a lot of hips who find it the easiest are hips who have had experience with acceptance commitment therapy, which is a therapy model we use a lot of, and especially the focused acceptance commitment therapy model. So any of those skills really sets up a person to find the journey into hipping a lot easier. And I guess just someone who's looking for something a little bit more innovative, and you know, it's a really new way of working for the clinician and the GP clinic. So anyone who's up for something new and exciting. We follow quite a structured model of care, so I guess having that flexibility and adaptability while being able to work within a certain structure is kind of what makes awesome hips. Really kind of using the peer group as a support network, really, because it is quite an isolating role at times. We're often the only hip or health coach in a practice, and so you don't have that other hip or health coach to go to and go, hey, what would you do, or I just did this and I'm not sure what to do next. So really accessing that peer group. We have monthly peer supervision, which is a really nice way of us as hips being able to get that peer support from our colleagues. And also the TAPO who run the training for hips have quite a structured 6-month program for supporting new hips, including an online mentoring hour where any hip from the country can join in and ask questions, get feedback, get support. And then of course there's local trainers working up here who can also be kind of called on as needed for any kind of supports. We also really encourage that hips observe each other in practice, so that's a really nice way to get support and to learn and see how a hip might be working in a different practice context, different demographic of patients, so that's another really neat way to be supported.